You think STIs only mess with your private parts? What if we told you they could break your heart? Literally, syphilis, HIV, hepatitis. You've heard the names. Maybe you've even joked about them. But let's be crystal clear, these infections aren't just about sex. They're about circulation inflammation, blood clots, and cardiac arrest. Can an STI affect your heart? The answer will shock you. Like, if your heart just skipped a beat. Subscribe for more uncomfortable truths that save lives. Comment, I had no idea if this just blew your mind. If you care about your heart, your health, and your future relationships, do not skip this. This could be the most important 10 minutes of your week or your life. Your heart is the MVP of your body. It never stops working for you. Not when you sleep, not when you cry, not even when you're ghosted on a dating app. But what if something you can't even see is out to destroy it? Something you picked up on a random Friday night from someone whose name you forgot. The next morning, sexually transmitted infections, or STIs, don't just stay down there. Once inside your body, many of them go global. Your bloodstream. It's their freeway. Your heart. A prime destination. Dr. Amanda Reyes, cardiologist at UCLA, explains, when people think of STIs, they usually think of itching rashes, maybe some painful urination. But what's often overlooked is that some infections can silently inflame the heart, damage the aorta, or trigger clotting, all without obvious symptoms until it's too late. Patient story. Daniel, 26. Daniel was a fitness influencer. Vegan, ran 5Ks on weekends. One day he fainted in the gym. Turns out he had developed myocarditis, inflammation of the heart muscle triggered by untreated HIV. I didn't even know I had HIV. I wasn't sick. I felt invincible. But the virus was already setting fire to my arteries. Daniel is alive today because a sharp ER doctor ordered a full viral panel suspecting something wasn't right. That test saved his life. STIs like HIV and syphilis enter the bloodstream. The heart and arteries are vulnerable to chronic inflammation. Infections trigger an immune response which over time becomes a destructive storm. What infects the body silently can scar the heart permanently. And if you thought STIs were just about short-term discomfort, wait until you meet syphilis. The OG silent killer. Long before dating apps, there was syphilis. And no, it didn't go away, it just got quieter. Incubation, hidden stage. Syphilis is caused by treponema pallidum, a bacteria shaped like a corkscrew. It can lie low for weeks, sometimes months, before revealing any signs. Symptom, phases 1, primary syphilis. 3 to 6 weeks after exposure. Painless sore chancre at the infection site, genitals, mouth, or anus. Most people ignore it because it doesn't hurt, too. Secondary syphilis weeks later. Rash on palms and soles, fever, swollen lymph nodes, fatigue, patchy hair loss. These symptoms go away on their own, fooling people into thinking they're fine. 3. Latent stage, no symptoms at all, can last for years. Bacteria is still in the body, slowly attacking organs. 4. Tertiary syphilis. Years later, the most dangerous stage. Bacteria damages the heart, brain, eyes, and bones. Irreversible effects or worse, death. Tertiary syphilis can lead to a terrifying condition called syphilitic aortitis, inflammation of the aorta, your body's biggest blood vessel. If it bursts, it's over. Other cardiac complications, aortic valve leakage, leads to heart failure, coronary artery narrowing, leads to heart attacks, inflammation of the heart lining, pericarditis. Dr. Marcus Dunn, infectious disease specialist. One of my patients had syphilis for over a decade without knowing. By the time he came in, he was in early heart failure. The bacteria had been gnawing at his aorta for years. Patient story. Jake, 35. Jake was a barista in Portland, always joking about his dating life. He came in complaining of chest tightness and lightheadedness. Doctors first thought it was stress, but his aorta was enlarged and inflamed. A CT scan revealed a syphilitic aneurysm. I had no idea. I didn't even remember when I got infected. It was probably years ago. Jake underwent emergency surgery. He's alive, but he'll be on heart meds for life. Diagnosis: blood tests, RPR and VDRL screening, followed by FDA ABS confirmation. If you have cardiac symptoms, ECG, echocardiogram, chest, CT treatment, early syphilis, 1 injection of penicillin, bicillin, LA, late or tertiary syphilis, multiple doses over weeks. Cardiac damage may require surgery and cardiologist supervision. Important treatment stops the infection, but doesn't reverse existing damage. Prevention: always use barrier protection condoms or dental dams. Get tested every 6-12 months if you're sexually active. Know your partner's status. Avoid anonymous sex or use pre-encounter testing agreements. The scariest part about syphilis isn't the rash or the sore, it's that you can be fine for years until suddenly you're not Ava, 31, artist and survivor. There's a metaphor buried in all of this. Syphilis is like a toxic relationship. It starts with charm, seems painless at first, then comes the confusion, the rash of doubt, the inner fatigue. If you don't walk away and heal early, the longer you wait, the harder it is to recover. If you haven't had a full STI panel in the past 12 months, take 10 minutes this week and do it. Your heart, your literal beating, loving heart, deserves protection. We've heard this line too many times. HIV is just about the immune system. Right, wrong. It's not just about T cells and infections. HIV also sets your heart up for a ticking time bomb. After HIV first enters the body through unprotected sex-shared needles or other blood contact, most people don't feel anything for 2 to 4 weeks. But here's the twist: that's when the virus is going full beast mode. During this acute stage, your body is in a silent war. The virus is multiplying rapidly and your immune system is reacting. But most people mistake it for the flu symptoms of early HIV acute stage: fever, sore throat, muscle aches, night sweats, swollen lymph nodes, fatigue. Most teens and young adults dismiss it as being run down or just overworked. Clinical Insight, Dr. Melanie Cruz, infectious disease specialist at NYU, explains, "The biggest danger in HIV isn't how it starts, it's how quietly it moves. People walk around for years not knowing they're infected. And during that time, the virus is triggering long-term damage in the background, including inflammation in the blood vessels, HIV, and the heart. Once HIV goes untreated, or even under chronic infection control, the body is in a constant state of inflammation. That inflammation affects your endothelium, the delicate lining inside your blood vessels, leading to stiffness, microscarring, and fat buildup. This process is the root of early atherosclerosis, which is the fancy term for your arteries are clogging way earlier than they should. People living with HIV have a 1.5 to 2 times higher risk of heart attacks and strokes. And this risk is present even when they are on antiretroviral therapy. ART. Yep, the very meds that help suppress HIV can sometimes also raise cholesterol or interfere with fat metabolism. Real patient story. Leah, 29. I was just 29. No smoking. I went to the gym. I never even drank soda. Leah was a graphic designer in Austin. One Monday morning, she collapsed at work, a heart attack. Doctors were stunned. But what the cardiologist found during her workup changed everything. She had HIV. She had probably been living with it for at least 6 years and didn't know it. That prolonged inflammation had narrowed 2 major arteries. Said Dr. Benson. The ER doctor who saved her, Leah, survived. But she now takes 4 different heart meds alongside her HIV therapy expert. Tip Dr. Eric Talbot, professor of medicine at Johns Hopkins. HIV changes the rules of the game. Even if you're managing the virus, you have to think long-term heart health, blood pressure, lipid panels. It's not just about the virus, it's about what the virus triggers in your body. Disease progression recap. 1. HIV enters body. Mild flu-like symptoms. 2. Virus hides in the body for years. Latent phase 3. Meanwhile, chronic inflammation damages blood vessels. 4. Risk of heart attack, stroke, and hypertension increases. 5. Sometimes the first sign isn't an STD symptom, it's a cardiac emergency. People with HIV are also at higher risk of blood clots, arrhythmias, and cardiac infections. Combine that with smoking, drug use, or poor diet, and you've got a deadly recipe. Prevention tips. Get tested for HIV every 6 to 12 months if you're sexually active. If HIV+, make sure your doctor monitors O blood pressure, O cholesterol levels, O C-reactive protein inflammation marker, O cardiac function. With ECG or echocardiogram if symptoms develop. Avoid smoking heavy alcohol and processed fats. Exercise and eat heart-healthy foods. Talk to your doctor about switching HIV meds if lipid issues arise. When you hear hepatitis, you probably think liver, but what if we told you? The real threat might be in your blood vessels. Hepatitis B and C. Both are blood-borne viral infections. They primarily attack the liver, causing inflammation, scarring, fibrosis, and even cancer, but the damage doesn't stop there. The blood-liver connection. The liver filters your blood every 3 minutes. Your entire blood volume passes through it. When it's inflamed, it affects everything. Increased systemic inflammation. Immune complexes. Clumps of antibodies and viruses clog tiny blood vessels. Endothelial dysfunction. Yes, again, it harms blood vessel lining. All of this leads to higher stroke and heart attack risk. People with chronic hepatitis C have a 27% increased risk of cardiovascular disease. Even after successful treatment, risk remains elevated if there was long-term inflammation. Hepatitis B is also linked to pericarditis, inflammation around the heart, and vasculitis, inflammation of blood vessels. Real-life story. Rosa, 34. I didn't feel sick. I didn't have yellow eyes or anything. Rosa was a school teacher. During a blood donation screening, she was told she had hepatitis C. She didn't know where it came from. Maybe an old tattoo, maybe an old boyfriend. She started treatment, a 12-week antiviral course, but during a routine follow-up, her doctor found plaque buildup in her carotid arteries. Her blood pressure had also spiked. I thought it was just stress. Turns out my liver had been screaming for help for years. I just didn't listen. Expert viewpoint, Dr. Sarah Newton, hepatologist at Mayo Clinic. Hepatitis doesn't just destroy liver cells. It keeps the immune system on constant alert. Over time, that leads to collateral damage, especially in the blood vessels that supply the brain and heart. Chronic hepatitis can lead to clumps of immune proteins floating in your blood. These clumps block small vessels, especially in your skin, kidneys, and heart. Result: weird rashes, high blood pressure, fatigue, and heart complications. Treatment overview. Hepatitis B. No cure but controlled with antivirals, tenofovir. Entecavir. Regular liver monitoring. Hepatitis B vaccine for prevention. Hepatitis C. Cure rate over 95% with direct-acting antivirals. 8 to 12 weeks of oral meds, Harvoni, Epclusa, etc. Prevention tips. Don't share razors, toothbrushes, or needles. Get vaccinated for Hep B. Use condoms. Ask for Hep B and C screening and blood tests if you've had unprotected sex. Oh, you've gotten tattoos in unlicensed shops. Oh, you were born between 1945 and 1965. Baby boomers, life value insight. Sometimes the body's loudest signals are silent. No fever, no rash, no yellowing skin. But beneath the surface, damage is building. We've shown you how STIs like HIV, syphilis, and hepatitis can break hearts, not figuratively literally, but why does this happen? What's the science behind all this silent chaos? Here it is in one line. Inflammation plus bloodstream, Druid's recipe for disaster when your body detects an infection, say HIV or syphilis. It sends out its warriors' white blood cells, cytokines, immune complexes. This is called inflammation. Now, inflammation by itself isn't bad. It's how your body heals. But when inflammation becomes chronic, long-term, and relentless, that's when the damage begins. What's happening inside the body? STIs enter through mucosal surfaces, mouth, genitals, rectum. Some, like HIV or syphilis, invade the bloodstream. Your immune system responds and keeps responding. Over time, that inflammation starts eating away at your blood vessels. The result: tiny tears, plaque buildup, clots, artery stiffness, and yes, heart attacks. Your endothelium is like the Teflon lining of your blood vessels. It helps regulate blood pressure, clotting, immune response, blood flow to your organs. But chronic infections damage this lining. Imagine a road where the pavement keeps cracking eventually, traffic gets rough, and crashes happen. Expert commentary. Dr. Rachel Kim, cardiovascular researcher, Stanford endothelial dysfunction, is at the heart of almost every modern disease. Infections like HIV, hepatitis, and even herpes can trigger a cascade that leads to permanent damage in your arteries, sometimes before any visible symptoms. Some STIs confuse your immune system so badly that it starts attacking your own body. This is called an autoimmune reaction, and it can cause vasculitis, inflamed blood vessels, myocarditis, inflamed heart muscle, pericarditis, inflamed lining around the heart. Real-life story. Jayla, 19. Jayla was a sophomore in college. She was diagnosed with hepatitis B from a past hookup. After starting treatment, she began to experience joint pain, chest pressure, and fatigue. Her doctor discovered immune complex vasculitis. Her body was attacking its own blood vessels triggered by the virus. I never thought something from sex could hurt my heart and joints at the same time. It felt like my body had turned on me. Here's how chronic STIs work like a slow-burn tornado in your body. They hide quietly for months or years. Your immune system keeps fighting. That constant fight leads to invisible damage. Your blood vessels weaken. Your heart takes the hit. Ever heard of a cytokine storm? It's when your immune system goes so overboard that it floods your system with inflammatory proteins. This happens in severe cases of HIV, hepatitis, and even untreated herpes. These storms can cause multi-organ failure, blood pressure crashes, and, yes, cardiac arrest. Professor commentary. Dr. William Stone, Harvard School of Public Health. The immune system is a double-edged sword. When it's out of balance, as we see with chronic STIs, it doesn't just protect the body, it harms it. Think heart disease is something for your grandpa. Think again, because here's the thing about STIs. They don't care how young, hot, or healthy you look. STIs are rising fastest among the 18 to 29 age group. Many carry zero symptoms for months or years. Damage begins long before you feel anything. You post gym selfies, you meal prep, you run 5 miles every Saturday. But when was your last STI test? Real story, Mason, 24. Mason was a certified personal trainer, AT clean. Lifted, heavy, dated, casually. He got diagnosed with HIV after an STI screening. His ex encouraged him to take no symptoms, no signs. But his doctor found early signs of arterial inflammation and a resting heart rate abnormality. I thought I was the picture of health. Turns out my insides were at war. Now on medication, Mason speaks openly about STI testing at his gym. We train our muscles every day. We need to train our awareness too. Expert takeaway. Dr. Samira Lee, infectious disease consultant. The problem with many young patients is they don't show up until symptoms are dramatic, like shortness of breath fatigue or even fainting. By then, we're not talking about prevention anymore. We're talking damage control. Let's get one thing straight. STI testing isn't about shame. It's not about guilt. It's about power. When you test, treat, and talk, you're not just protecting your parts. You're protecting your beat, heck list for a healthy heart and sex life. 1. Use protection. Whether it's a long-term relationship or a weekend situationship, condoms and dental dams reduce STI transmission by over 90% when used correctly. Yeah, but it doesn't feel the same. Okay, but neither does heart failure at 27. Reality check. Protection isn't just about pregnancy. It's about your bloodstream, your future, your freedom to love safely. 2. Get tested. Every 6 to 12 months. This one's big STIs don't always show symptoms. You could be carrying one for years without a clue. Real fact, 1 in 5 people in the U.S. has an STI right now. Most don't know it. That's why regular testing matters. Real life story. Day on 23. I only got tested because my girlfriend made it a relationship rule. I had chlamydia, I felt nothing. No symptoms. But my doctor said if it had stayed untreated, it could have affected my fertility and even my heart valves. Now, Dion speaks at college dorm events about routine testing. He calls it the gym checkup for your bloodstream. 3. Know your partner's status. It's awkward, yeah, but if you can ask someone to sleep with you, you can ask them to test with you. Conversation starter. Hey, let's both get tested so we can go all in with peace of mind. If they get weird or refuse, that's your answer. Your heart deserves better. 4. Seek treatment. Early STIs are highly treatable. Some, like chlamydia or syphilis, can be cured with antibiotics. Others, like HIV or hepatitis, can be managed with medication that protects your health and stops transmission. But timing is everything. The sooner you start treatment, the more of your heart you can save. Literally, Dr. Julia Mannheim, infectious disease expert, Columbia. 5. Don't ignore weird symptoms. Even if it's just fatigue. Your body whispers before it screams. If you're feeling constant fatigue, random chest tightness, shortness of breath, or even weird brain fog, don't just say, I'm stressed. Check in with your doc. Emotional testimonial. Kim, 28. I thought I was just tired from work. I was teaching middle school and going to grad school, but one night I collapsed while walking home. Doctors ran tests. Turned out she had hepatitis C, likely contracted from a shared piercing needle years ago. She was also in stage 2 liver inflammation and had early signs of blood vessel damage. I didn't drink, I didn't party, I didn't even know I had it. But treating it probably saved my liver and my heart. Today, Kim is cured. She now creates TikToks educating young adults about hidden STIs. You only get one heart. It doesn't take a break. It doesn't swipe left. It doesn't ghost you or cancel plans. It just beats. For you. Every second of your life, STIs don't just mess with your sex life. They mess with your liver, your lungs, your brain, and yes, your life expectancy. But you're not powerless. You have the tools, you have the choice, and now you have the knowledge. If this video taught you something real, hit that like button to say, I got this. Share it with someone you care about. It might just save their heart. Subscribe to join the most informed crew on the internet. Comment, I choose my heart. Because as sit here with teenagers, we don't just talk, we protect what matters.